Welcome everyone to this webinar on reaching rural areas in the social protection response to COVID-19, opportunities and challenges. Today's webinar will be available in English and French. This is the 24th webinar of the social protection responses to COVID-19 webinar series. The series is a joint effort initiated by the IPCIG, GIZ on behalf of the German Federal Ministry for Economic Cooperation and Development and the Australia government's Department for Foreign Affairs and Trade, in collaboration with the socialprotection.org platform and in cooperation with partners from different organizations. For instance, this webinar is organized today with also FAO and ILO. The webinar series is part of an initiative with other components. One is the collaborative mapping of country news and documents, which is disseminated through a weekly newsletter. And there is also an online community, which you should join if you haven't already. It's called Social Protection Responses to COVID-19 Task Force, and you can learn more about the initiative, collaborate, and also keep updated about the future webinars. And I just wanted to mention that the next webinar will be on Thursday, July 30th, and it will focus on social protection and child marriage. Don't forget to register. Today, we will have an intervention from Cecilia Mbaka. She will focus on what the government of Kenya is doing together with partners to support vulnerable people in the face of COVID. Rima Nanavati from SIWA, I will introduce them properly a bit later. She will provide the citizen's perspective, in particular self-employed women who are so often uncovered by social protection programs. Mounir Sherif from Tunisia will focus on the case of Tunisia and will bring the perspective of the rural and agricultural sector. Professor Tang Lisha from China will explore how to help farmers in the face of COVID-19, and she will present measures taken by China to support livelihoods in rural areas. After the four presentations, we will have Krum Markov from ILO, and he will discuss a bit what the panelists have said and will bring a global perspective. And I will be your moderator today for this session. And to tell you a bit more about our panelists, I will start with Cecilia Mbaka. She's the head of the National Social Protection Secretariat in Kenya. She was previously the head of the Division of Social Welfare and Older Persons. Mrs. Mbaka has more than 25 years experience providing strategic leadership and engagement of civil society and research stakeholders to advance policy development and strengthen service delivery to vulnerable persons. We're very happy to have you, Cecilia. Then we have Rima Nanavati. She's director of the Self-Employed Women's Association, SIWA, from India. She has worked for SIWA for over 35 years and has managed to bring its membership to 1.5 million members. It's now the single largest union of informal sector women workers. Rima oversees 4,813 self-help groups, 160 cooperatives, 15 economic federations in India, across India, including 16 states, as well as in 7 South Asian countries, focusing on women's economic empowerment by building women's own enterprises, building women-led supply chains, and ICT. We also have Mounir Sherif. He is a social protection expert from Tunisia. He has 34 years of experience in the sector. He has worked extensively in Tunisia, for instance, for the CRES and CNSS. And he has provided also technical assistance to other countries throughout his career, in particular in Francophone Africa. And he now focuses mainly his work on innovative mechanisms to extend social security coverage and conducting assessments and strategic studies to ensure the sustainability of social security schemes. Professor Tang Lisha from the China Agricultural University. She's the Deputy Dean, College of International Development and Global Agriculture. She works on poverty analysis and livelihood development, social policy analysis, international development aid, and also China engagement in Africa. She has extensive experience working also in Africa in particular, but also India, Thailand as well. Our discussant today is Grum Markov. He's social protection policy specialist at ILO. He's been working at ILO since 2001, and now he is at the social protection department, so SOCPRO. Through his work, he supports ILO's constituents design and implement comprehensive social protection policies and right-based systems grounded in the principles enshrined in ILO standards. I will be your moderator today. I work at FAO, I'm a social protection officer, and I focus on the extension of coverage, as well as on resilience and economic inclusion. And thank you to all the panelists for joining us today. We have very rich and diverse backgrounds and experiences that will be represented today, and that will make for a very rich webinar. Today's webinar focuses on the coverage of rural populations by social protection programs. And these programs have been expanded or created to respond to COVID. The past 23 webinars of this series are focused on that. Social protection has dramatically expanded in the face of COVID-19 to offset or limit the socioeconomic impact of the pandemic. But this expansion has happened in a context where coverage was imperfect. In fact, far from it. 55% of the world's population was uncovered by any type of social protection pre-COVID. And that was in many instances because of specific barriers that limited this coverage. For rural populations who tend to be poorer and more vulnerable, the barriers were higher, and they faced a lot of difficult circumstances to access social protection benefits. The expansion of social protection in the face of COVID has provided an opportunity to reach these populations and bridge the coverage gaps in a way. But at the same time, the same barriers, physical, administrative, legal, financial, they still exist. Rural populations are also seen sometimes less vulnerable to the impact of COVID-19. However, they're tremendously indirectly affected, and many of their livelihoods have been disrupted by the pandemic. The expansion of social protection to rural populations, in particular in synergy with productive support and access to essential services, is critical for an inclusive recovery. This webinar will therefore explore how governments have managed to respond to these specific needs, which challenges have been encountered along the way, and what lessons we can draw from these experiences. Each presenter will have about 10 to 12 minutes for their intervention, and we will follow with discussion, and then we will move to questions and answers. We encourage you to send your questions throughout the webinar at any time. You just use the chat bar on your right. And you can also interact with us on Twitter using SB Gateway and the hashtags that you see on your screen. I would like now to give the floor to Cecilia Mbaka for her presentation. Cecilia, the floor is yours.
Thank you, Anna, for the introduction, and hello to all who have joined us in this webinar. As Anna has said, I will be sharing with you how Kenya is responding to COVID-19, led by the government of Kenya in collaboration with other partners. And I will also share with you the challenges that we are facing as we respond to COVID-19. So next slide, just to put Kenya into perspective, Kenya has a population of about 47.5 million, and out of these, that 6.5 live below the poverty line. And a total of 14 million, 1.3 million, and 42 million live either in rural, peri-urban, and co-urban, and informal settlement, respectively. The other major thing about our country is that 80% of Kenya's landmass is characterized by aridity. And people living in these areas experience climatic shocks and are exposed to many other forms of vulnerabilities. Next. On response to COVID-19, to date, Kenya has recorded over 16,000 cases with about 7,500 recoveries and 278 deaths. Now, majority of these cases are concentrated in Nairobi, which is the capital city of Kenya. And as we all know, this pandemic will definitely exacerbate or increase poverty due to job losses in the agricultural sector, which is the main livelihood for the rural communities in Kenya. Already, the pandemic has triggered massive job losses in the service industry in both rural and urban areas, and especially people working in flower farms, in horticultural farms. For a couple of months, we had movement restrictions imposed by the government to stop the spread, which, as we would imagine, it is really going to disrupt food production gradually that is produced by smallholder farmers. Over 80% of food consumed in Kenya is produced by smallholder farmers in rural areas. And so if they are affected, then it means that this will also affect our food production. Next. The government is, together with partners, I said, is making efforts to reach the rural communities. And it has established mechanisms within on how to do this. Although the concentration of the cases are reported in Nairobi, we have also seen an increase of the cases in rural areas, and especially from the beginning of this month, the month of July, when the government lifted the lockdown in Nairobi and in some rural counties. We are seeing more people moving to the rural areas and escaping from Nairobi. And so this is also increasing the infections in the rural areas. And so the government has made several attempts to respond to COVID-19. It has established an 8-point economic stimulus program worth $53.7 million US. And I would want to share with you some of the economic stimulus that the government has come up with. On treatment, the government is providing free health services for COVID-19 patients in all rural areas and urban areas, whether they need treatment or whether they need to be quarantined. It is being provided free by the government in government institutions. A fund has also been established to cushion the vulnerable households from the effects of the pandemic, and majority of those who are being reached are actually those living in the rural areas. The government dispatches money to the identified beneficiaries on a weekly basis, and this money is sent through the mobile money, so it is efficient, it is timely to be able to respond to the crisis. Next. Next, please. We also have some money that has been set aside for the youth, because as you would imagine, majority of the people who have lost their jobs either in semi-urban areas or even in the rural areas are actually the youth. So the government has also set aside some money so that the youth can be able to engage in some small-scale enterprises, and also to even be engaged in some works in the villages. To cushion small scale holder farmers, the government has also set some money aside to cushion them alongside flour and horticultural producers. As I said, we have lost a lot of employment in the flour and horticultural industries, and so money has also been set aside to be able to cushion them. A particular focus is being paid to the most vulnerable communities and groups, especially children, teenagers, elderly, and citizens with lifestyle diseases, because we know these are the ones who are being hit hard by the disease, and also counties that have higher prevalence of malnutrition. We have some counties in our country which have a lot of prevalence on malnutrition, and especially countries in the arid and semi-arid lands. UNICEF has also planned to provide additional transfers to part of the current government cash transfer beneficiaries in both rural and urban areas to cushion them from the effects of COVID-19. And this is being based on poverty and specific health indicators, which UNICEF and the government have already agreed on. Next. On gaps and challenges, although Kenya is spending about 0.4% of the GDP on social assistance, this does not adequately cater for the needs of the people who need assistance by the government. And with the COVID-19, this has definitely gone up. And as we said, with the job losses, the demand is even getting higher. And so what this means is that the government will need to see how this percentage can be increased so that it can be able to reach more people. The other challenge that we are having is weak coordination mechanisms. We have a number of people who are responding, or a number of stakeholders who are responding to COVID-19. However, as a country or as stakeholders, we are not very well coordinated. We are not speaking to each other. And so there is a danger that many of us are reaching same people, and we could have so many people who are being excluded. If we were well coordinated, then we would ensure that different stakeholders reach different people, and horizontal expansion then would become a reality. The other challenge that we have, as a country, we do not have a social registry. What we have is a single registry. The single registry is hosting data on existing beneficiaries. If we had a social registry that could host data on potential beneficiaries, then it would have been very easy responding to COVID-19. But because of lack of that, then it becomes more difficult, and it's even more challenging because of the issues of social distancing. So one thing I think I would want to assure you is that we are not likely to be getting to the right people, and especially, as I said, because of the issue of social distancing. We are in the process of establishing the social registry, and we were in fact wishing we had done this earlier, because then it would have been easier targeting those who need to be targeted. The other challenge that we have been having is that the transfer values are not harmonized. The government, the transfers that the government has been giving has not been revised for almost 10 years now. So as we have been responding to COVID-19, the government has kept to its transfer value. We are seeing other partners coming in and giving almost more than double what the government is giving. So because of the inflation, then the government transfers might not be able to meet the food basket. And so that is also the other challenge that we are having. The other thing is that 4 out of every 5 Kenyans have no access to medical insurance, with disparities of about 12% and 27% in rural and urban areas respectively. This means that majority of the people cannot be able, in the rural areas, cannot be able to access health. even if the government is providing free services for those infected by COVID-19. I think from experience, we are seeing other opportunistic diseases coming. And so it means that if they are not covered, then they are not able to access the health cover. Now, the other thing is that with the exception of a pension scheme for persons who are aged 70 years and above, social assistance programs are targeted, leading to a lot of inclusion and exclusion errors. And this what means is that majority of the people who require to be covered are not actually being covered, exposing them to a lot of shocks. Next. Next, please. Yes, I thank you. Thank you so much. Over to you, Anna.
Thank you so much, Cecilia, for this very interesting analysis of Kenya's response, in particular the focus on livelihoods, which is critical for recovery. Your points about the adequate investments, coordination, and the need for strong administrative systems in place are valuable lessons applicable in many, many countries of the world. So thank you for sharing this experience. I would like now to invite Rima Nanavati to take the floor and present the views of self-employed women and workers from the informal sector in general.
Thank you so much. It's been a real honor and privilege to be on this panel. I hope I'm audible.
Yes.
Yep. Thank you. I think I'm neither from the government nor from the academia, so I will be bringing the perspective of the community, the citizens on the floor today. And let me begin by saying that I'm representing here the 1.9 million women workers in the informal sector in India. COVID-19 response so far in India has been by default urban oriented, including the lockdown, the social distancing, the provision of medical facilities. It is only when the migrant workers started returning home empty-handed, without work and empty pockets, without due salaries and savings, that the rural areas attracted attention of the policymakers. Though we all must recognize that various national and state efforts were made to reach out to the rural areas, but by and large, the rural areas and therefore the rural workers have been an afterthought. A study conducted by SEWA of its 1.9 million members showed that for these workers, the current pandemic and the lockdown directly and in a very destructive way has been affecting their work and income. Almost 40% of the informal households have completely lost all of their livelihoods. Over 43% have been forced to reduce their food, and over 73% need food grain support to sustain themselves if the current situation extends further, including now the migrant workers. The children who had just started going to school have faced a setback, at least for a year, and in many cases we will see dropout rate, especially amongst the girls, would be high. Almost in 25% households, women and girls face abuse and violence from men. Food intake is reduced as money was not available directly in women's accounts. The Janadhan accounts women could not access due to lockdown, even though the government was doing cash transfers. Whatever assets that the women had in terms of savings, in terms of working capital or land, are lost or have become redundant. So therefore, I think social protection related studies, policies and programs have by and large remained sectoral and not area specific. That is that social protection for rural areas and social protection for urban areas are always treated differently. And this shortcoming needs to be addressed as soon as possible. Let me explain this by a very concrete example. There were the vegetable vendors in the cities who completely lost their livelihoods due to lockdown as a result of the pandemic. And there were the vegetable growers in the rural areas who also could not sell their vegetables as the markets had closed, transportation was not possible, and therefore had to just leave their vegetables to rot in the fields. And Seva thought of connecting the rural vegetable growers with the urban vegetable vendors by giving them electric rickshaws. And as a result of that, both the urban vendors as well as the rural vegetable growers, their livelihoods were restored. And today now this has become a full-fledged enterprise which is selling vegetables online. The vendors now have dignity. They no longer have to sit on the streets, but they deliver or do home delivery of vegetables, fruits, and other supplies, and the vegetable growers now have direct market. Various relief and related measures have reached rural areas where existing social protection related policies, institutions, community participation was already active. In other words, I would like to say that where social protection reached, it was able to address to an extent the loss and damage caused by COVID-19 and its response and the economic slowdown. The initial national attention, the countrywide efforts, and the medical as well as financial measures has taken longer and is taking longer to reach the rural areas. The financial package offered to the vulnerable and the poor population can only be accessed and beneficially utilized when social protection measures have given some stability to the lives of the rural citizens and the workers. Uh, Here, the role of the community organizers, the union organizers, the community leaders plays a very important role. When the social protection packages are announced, it was these community organizers which ensured that all workers, irrespective of whether they are domicile or they are migrant workers returning back, they get the entitlements that were due to them. It was found that several of the rural households did not have the needed documents, and it was these workers that played a very active role to make sure that the women's bank accounts were active. If they were dormant, what were the measures needed to taken to activize those accounts? Women and the households who did not have the documents which were needed to access the public distribution system, how do they get those temporary documents which were then converted into um, permanent documents? The community organizers also made sure to see that the due entitlements in terms of quality and quantity both were assured. So I think we should see them as the human capital which will turn the social protection measures and mechanisms and make those mechanisms very active, and the social protection measures as the rebuilding measures. Having said the above, I very much welcome the ILO and FAO's focus on rural areas. The above challenges are not new, and therefore we know how to start addressing these challenges. Let me focus on some opportunities that this pandemic is offering. First of all, social protection measures do not work if the rural poor and the vulnerable families have no work or income, or work and income has reduced, interrupted, delayed, or lost. We have unprecedented opportunity to offer universal basic income programs or at least a minimum support income to all rural workers, at least to start with the women workers who are already organized. Sustainable investments must be made in these organized poor women to first stabilize their households and second to reach out to even larger number of similar households. Here I would like to mention that there is a need to design social protection measures which are integrated. So access to finance, access to capacity, and access to markets. This will help in stabilizing the livelihoods and then make the social protection measures much more meaningful. We have ample evidences and examples to show this, that when women have access to market, to their agriculture produce, be it horticulture, floriculture, or vegetables, or coarse grains. SEWA designed a whole rural distribution network where from 25,000 farmers, all their produce was procured, graded, processed, packaged, and redistributed amongst the rural households. It was here that the social protection measures became much more meaningful. Similarly, we had landless women who were trained into converting coarse grains into bakery and confectionery items. And these women started producing these bakery items during lockdown, and they were an access market online. Today, 5,000 such women have their enterprise and the supply chain worked out. And in less than 4 months, their enterprise is now accessing digital platforms and marketing. So these landless women have been turned into entrepreneurs. The second opportunity that builds on the first, which I was just mentioning, is that this is the historic moment to design, develop, and roll out comprehensive universal social protection and preparedness measures for all rural workers. Social protection measures have to be responsive, comprehensive, and provide resources for economic and ecological needs of rural households, uh, and especially of the poor and the vulnerable. Again, we can start from the poor women workers who are organized. Third opportunity lies in converging the above two opportunities in the light of the unprecedented and timely recommendations made by the Global Commission on Future of Work that was constituted by the ILO. If we look at the challenges caused by COVID-19 and the opportunities offered by the pandemic, it is clear that rapid and wide-scale implementation of the Global Commission recommendations for rural areas is the most important way to go ahead. Fourth and the last opportunity lies in making COVID-19 related health response far more broader in rural areas to include community health, occupational health, public health education, neighborhood health, environmental hygiene, jobs and incomes available in health sector in rural areas, and the role of the economic networks of the rural poor. In the end, COVID response should not only offer protection to rural areas and workers, but in fact it should promote human well-being of these workers and women especially. We need to have a human-centered approach to social protection and to work. It is possible to at least start addressing the above. The women in the rural areas are ready. The workers in the rural areas are ready. The local authorities in the rural areas have to be willing. This is SEWA's experience that I would of working with almost 2/3 of its members who are rural out of the 1.9 million members, and having working with them for the past 4 months of the pandemic. Thank you.
Thank you so very much, Rima Nanavati, for this intervention. Thank you for bringing the voice of the 1.9 million informal worker women in India, and I'm sure of many other informal workers in the world. You have highlighted the catastrophic impact on informal workers, livelihood of the pandemic, impacting then their food security and nutrition, impacting their future, and the critical role that social protection can play to save livelihoods. I really appreciated you highlighting the role of community organizations and unions in supporting bridging the gaps of rural coverage to ensure that people can access the benefits that they're entitled to. We certainly should learn from the experience and build on the existing structures and local organizations. Your point about the need to design and implement integrated approaches that link social protection to other services and access to markets, financial services, and so on to stabilize and even promote livelihoods is well noted. As well as your call to adopt a human-centered approach to work and to social protection. Thank you very much for highlighting these points. I am now going to give the floor to Mr. Mounir Cherif from Tunisia. Mounir Cherif, the floor is yours. Sorry, I just want to remind you to turn on your audio.
Voilà, c'est bon?
Perfect.
Can you hear me?
C'est parfait.
Parfait. Perfect.
C'est bon?
Parfait.
Are we good?
Merci. Bonjour.
Thank
Je
you.
voudrais vous remercier.
Hello. I would like to thank you for having invited me for this virtual webinar. I'm very honored, and my presentation has essentially two parts. I would like to give you an overview of the social security scheme in Tunisia, especially the agricultural part, and secondly, the measures that have been taken to help especially vulnerable population compared with the confinement measures with this pandemic.
Next slide, please. So, about the context and the extent of social security in Tunisia. So, social protection scheme in Tunisia dates back to 1898. We had a number of different schemes depending on the status of the worker, a wage earner or a self-employed worker, and it also depends on the sectors. Today, social security covers all active population. So the structure of the current system is made of three elements: the public sector and the private sector, first of all. And for the private sector, you have 8 schemes depending on the status of the worker. A worker, a wage earner, a self-employed, and an agricultural worker. And then we have another facility which is targeting another profession. So, next slide, please. Next. So we have 4 schemes that were created. Agricultural workers. It was created in 81, and then progressively agricultural enterprises were created, and new activities emerged, and the wage for this category was based on 3 different categories, and the wage were quite low. That's why we created this scheme. And then we have another regime that was improved. And then in 82, we created a scheme for self-employed in the agricultural sector. And we also wanted to extend coverage depending on the contribution capacity of people. And we included small-scale farmers and fishermen, as they didn't have enough means to make their contribution. So we created a specific scheme for them. Next slide, please. So here I try to make an overview of the 4 different schemes for the agricultural sector, depending on the targeted population, the contribution rate. Almost all benefits enshrined in the convention, in the ILO convention, are linked to an employment benefit. And as you can see, the coverage rate is very low, 11.5 for the first category, 19% for the improved category. And in Tunisia, the contribution payment is on a quarterly basis, so there's a lack of capacity in terms of contributions. So hence the very low rates. And I think that there are a number of tools that we have to put in place in order to limit the barriers for people, to enable people to contribute and to have access to these schemes. So we have to put in place new payment systems and bring down administrative obstacles, among others. Next slide, please. So the financing base for the agricultural scheme is based on the 3 different categories. For the second category, we have the wage earners, and then we have the self-employed. We have to assess the actual income, and we have identified several ways to calculate these allowances, taking into account the contribution ability. Next slide, please. So almost all branches of social security are covered in Tunisia. We have the disease allowance, the death benefits, family allowances as well. But this does not include agricultural workers, as they do not have enough income to make their contributions. We also have the death allowance for agricultural wage earners. But we also have another benefit for self-employed people. And finally, we have the old age pensions, disability pensions, and survival pensions. So we have these different pensions, and we have also allowances for work accidents, and unfortunately this is on a voluntary basis. They do not have to adhere to this scheme, but this is not the case for the agricultural sector. For the agricultural sector, the coverage is not linked to the income amount, but it focuses and it is linked on the land area they are working on. Next slide, please. Here we have the assessment of the measures taken by the government to mitigate the impact of COVID-19. These measures, we didn't see any specific social measures targeting the rural areas. These measures are targeting everybody. They are general, and they managed to provide some support to vulnerable populations that who couldn't work because of the lockdown. And in Tunisia, the agricultural production is focusing on the wholesale market, but the farmers tried to circumvent this process. So, as I said, the measures were targeting all kind of populations, focusing on the families that had the most needs. Several categories. We have a program for beneficiaries with the highest needs, and this program is targeting several groups, and the state pays 180 dinars, which is more or less the equivalent of 55 euros, and this was increased on an exceptional basis during the lockdown by less than 20 euros, if I understood correctly. And then there is a scheme for health services, and in the agricultural sector, for those who have an activity of less than 45 days with the same employers, they are not affiliated to Social Security. So we have a number of workers in this sector that are not covered by the Social Security program. So that's basically 2.5 million people in Tunisia, and they benefit from this free of charge program. And the government granted an exceptional and a provisional support of 200 dinars, which is the equivalent of 55 euros, more or less. And to give you an idea, the minimum wage in Tunisia is 130 euros, so that's really low. So for those who were not registered for the Social Security program, they were able to register and to receive this income of 200 dinars. This provisional help was basically granted to everybody, the unemployed, those benefited from the first program I mentioned, wage earners, and a number of self-employed workers who were really left aside during the lockdown. for those who were able to receive this payment, there were a number of conditions, of course. The wage earner must be, of course, registered with this program. So it was an important obstacle for the wage earner to benefit from this help. If the employer didn't declare or register the employee, he couldn't get access to this help. So the government forced all companies to register their employees. We have a really effective legislation, but implementation-wise, we lack a number of tools, and there are a number of administrative barriers. The access to these funds, the centralization of these offices that you can find in big cities mainly. So these are obstacles, and the monitoring system is also poor, and that's why today an important part of the population has adhered to these programs. All active population is covered from a legal standpoint, but in practice, the effective coverage, so those who are affiliated to the program for the paid contribution, so that's around 60% only. For the agricultural sector, that's between 11 and 20%, and the problem is with the payment of the contributions. There are a number of barriers in terms of access, in terms of administrative processes. The income also, because the agricultural activity, this is a season-based activity. So the social security system have to adapt to the weather conditions as well in our country. And the response to the pandemic was focusing on health capabilities. So we focused on public health facilities, on healthcare workers, but we were not able to support in an adequate way the most vulnerable population because of financial issues. But in spite of all this, 300,000 euros were allocated to help people face this crisis, half of it for the economic recovery and half of it for social helps. And we also put in place an online platform to help people register to the registry. And the civil society also made a lot of efforts. They have distributed food, for example, for those who needed it the most. And
Merci
that's
beaucoup,
it for me.
Monsieur
Thank you very much.
Cherif. Thank you so much for this intervention, presenting the Tunisian social protection sector, the efforts put in place by the government to extend the coverage of social security benefits to agricultural workers. Also highlighting the barriers that exist and how the system has expanded in the face of COVID to also include informal workers. I think your presentation has also given us some insights on how to use this expansion, this exceptional expansion, in order to remove some of the existing barriers. I would now like to give the floor to Professor Tang Lixia, but before I do, I just wanted to remind all attendees that you can ask your questions at any time using the chat box. Just type whichever comment or question you may like to any panelists. We will get to this session shortly. Professor Tang Lixia, the floor is yours. Thank you.
Okay, thanks to organizers inviting me to join this discussion, and thanks to previous panelists for your wonderful sharing, and thanks to moderator brief introduction. I think it's my great pleasure to take this opportunity to share the experience from China on how to help farmers to fight against COVID-19. But firstly, I would like to thank you for these organizers, because it's a very great opportunity to meet Rima here, because I stayed in Sever for 2 weeks 15 years ago, long time ago. So I think during my stay in Sever, we have some communication, but at that moment I'm a young girl, but now I'm older than that time. So considering the limited time, I'm not going to discuss the impacts of COVID-19 on farmers' livelihoods. Rather, much focus will be based upon our topic on how to help the farmers to fight against COVID-19. I just reviewed the main activities has been adopted by Chinese government, and I refer to divided these interventions into 3 categories. Firstly, to ensure the basic livelihood of poor population in rural areas of China. So in China, there are 2 formal categories for poor population. The first category is called the registered impoverished families, which have been identified as poor households by the local community and the government in 2015. The registered impoverished family could get integrated supports from government, such as subsidy for education, health, and housing. They are priority targeting group for all supportive interventions from our government. The second category is called low-income families, of which average income is lower than local minimum income standard. So the low-income family could receive non-conditional transferring cash income to fill their gap between their actual income and the minimum income standard. Families in these 2 categories could get 1,000 to 10,000 yuan as a one-time living allowance, considering the family's financial difficulties since the COVID-19 epidemic and the price subsidy. Usual qualifications of low-income family should be checked for each quarter in order to withdraw those families which do not meet qualifications, or include new families which meet qualifications. Since the COVID-19 epidemic, the government has required to suspend the withdrawal of families and include more families which cannot go out to work and find jobs into this category. So if you are put in the list of this category, you can get the special living allowance from the government. Besides these 2 categories of families, the government also paid about 410 million yuan to 60,000 contract migrant workers. Everybody maybe know that in China, we have quite a big group of migrant workers. So the government also provided the subsidy to these migrant workers who have become employed because of the lockdown policies. Due to the loss of GDP growth by lockdown measures, the financial pressures for all levels of government are quite high. But even in this situation, the central government also has directed that all the allowances should be paid on time. The central government also issued 2 batches of relief funds, totally 156 billion yuan to the different provinces. This is the first category of the policy. The secondly, to support the farmers' employment and develop their own business through different channels. So the local governments have actively developed temporary jobs, such as special positions for poverty alleviation, public welfare, and social works, focusing on absorbing laborers from the poor households and the marginalized household for employment. The subsidy standards vary from place to place depending on the local financial situation and the living cost, but they are generally not higher than the local minimum wage standards. For example, in Kunming municipal government in southwest China set up about 3,000 jobs and provided 500 yuan subsidy to the workers per month. Changchun municipal government in northeast China set up about 800 jobs and provided 1,000 yuan per month. So different places and cities have adopted different types of labor subsidies and also the allowance for transportation to guide and encourage the labor from the poor household to go out for work. If you go out for work, each laborer could get about 200 to 600 yuan for living subsidy per month, and also can get 300 to 800 yuan for transportation, especially for the migrant workers. Local governments also provided one-time employment subsidy to enterprises, not only for the workers, and also provide subsidy to the enterprises that recruit new employees. Generally 1,000 yuan per person. If you got the one new employees, you can get 1,000 yuan from the government, and in the most place of China. But if you are in Wuhan, because Wuhan is the first city for the COVID-19, the enterprise can get 2,000 yuan for hiring a new laborers. During the epidemic prevention and control period, in response to the requirements of the state to support the resumption of work and the production and the stable employment of enterprises, local Department for Human Resources and Social Security generally adopt various social insurance to support the policies, including reduction, exemption, deferment, and return to encourage the enterprises to maintain employment, like to reduce the value-added tax to encourage to support the enterprises to operate. In terms of encouraging and supporting entrepreneurship, local governments also provided some subsidies and financial support for some people who come back to a rural area to develop their own business. So that's for the second category to generate the employment and also to maintain the income generation for the poor people. Certainly, the measures to guarantee agricultural production and reduce losses to agricultural producers. Last year, I think it should be in last October or November, November, China released the second white paper on food security and re-emphasized the importance of food security and food self-sufficiency. So agriculture is quite important, and the epidemic stage is just the cultivation season for agriculture in China. So the government takes all measures to guarantee the supply of agricultural inputs like seeds, pesticides, fertilizers, and agricultural film. So these measures include opening up the transportation channel of agricultural materials to ensure the smooth transportation of agricultural materials, to promote the opening of agricultural resource stores and the innovation of sales methods using e-commerce platforms, WeChat, telephone, hotline, and other channels to ensure normal sales of agricultural materials, and also to implement unified procurement, fixed point delivery, and open up the last mile of agricultural materials into villages and households. Because if the farmers cannot get the agricultural materials, they cannot cultivate agriculture on time, then we cannot expect the harvesting in this season. The government also provided the transport payments and agricultural subsidy to the farmers to invest agricultural production. So epidemic prevention measures caused difficulties in circulation of agricultural products. Because of the lockdown policies, the farmers cannot sell agricultural products to the market. So the green channels were also opened to ensure the smooth flow of logistics for agricultural products. Agricultural products such as grains, oils, vegetables, meat, eggs, milk, and aquatic products are included in the scope of daily necessities. Because if you are the commodity in the daily necessities during the period of epidemic prevention and control, the vehicles for these fresh agricultural products transportation could enjoy the green channel policy. Because if the vehicles for other kind of products, you cannot transport smoothly during the prevention and the control stage. But if the vehicles for the fresh agricultural products, you can use the expressway to transport to the different market to keep the supplier stable. And also you can get some, we called this policy as 3 no's and 1 priority. The 3 no's means no parking, no inspection, and no charge. And the 1 priority is the priority to access. So and the government also support qualified processing and the sales and the prices and the cold chain logistics and the prices to expand the purchase of fresh agricultural products through subsidies, interest discounts, and the government reserves, and also expand the scale of centralized procurement of local agricultural products by government agencies, schools, universities, hospitals, enterprises, and institutions, and promote assistance measures such as purchase instead of donation to promote sales. And also we use some new technology, mobilize new e-commerce platforms such as social e-commerce, community group buying system, and a small video to sell especially agricultural products from poor area, and also for some unsellable agricultural and livestock products through special forums, living broadcasts, and special events. Even last week, I was in Yunnan province to work as living broadcasters to help the one village to sell their red pearls. So this is the 3 categories interventions has been adopted by Chinese government to help the farmers to fight against the COVID-19. So in summary, in fighting against this new virus, China has adopted 3 fundamental types of measures to ensure better livelihood in rural areas. The first one is to guarantee the agricultural production's recovery and food security. The second one is promoting non-agricultural employment recovery to ensure income generation. And the third one is guarantee the vulnerable groups' basic needs by using non-conditional cash transferring. So that's my sharing. Thank you for your attention.
Thank you very much, Professor Tang Lixia, for this presentation and detailing for us the support provided to vulnerable people in China, including migrants. This was very important. Going through the different measures that were adopted to support employment, but as well as entrepreneurship. As you rightly pointed, also ensuring access to markets, to input and output markets through the use of new technologies and ICTs, providing subsidies to farmers, facilitating the circulation of produce is really important to support agricultural livelihoods and also to support food systems as a whole. So this was a very welcome addition. Thank you so much for these points. I would now like to invite Mr. Krum Markov from ILO to come in for a few comments to what we just heard. Thank you, Krum. The floor is yours.
Thank you, Anna. Thank you to all the participants and who presented such a wealth of information regarding how the countries in which they live responded to the crisis, especially from the point of view of rural areas and social protection responses. I think one first observation is that we have seen that in many countries worldwide, the current crisis actually, especially for the development of social protection in rural areas, represented a formidable opportunity to think out of the box and get out of usual comfort zones in thinking of mechanisms and designing responses to extend social protection to rural areas. What are the challenges that we face normally? The challenges are two, so to say. On the one hand, rural populations face the same risks as populations living in other areas, in urban areas. They suffer sickness, they're prone to become disabled, they may face unemployment, maternity, the loss of the breadwinners for families with single income, the employment injury, and so on and so forth. But on the other hand, these populations' livelihoods are to a large extent different, and responses also need to take into account the specificity if we are to successfully respond to their needs in terms of social protection, especially also in designing the social protection measures during the pandemic and beyond. So firstly, I want to stress that the work patterns in rural areas are often different from those prevailing in urban areas, where, for example, salaried employment is the norm, whereas we know this is not the case when it comes to rural areas that are often composed of individual farmers, often subsistence agriculture, where you have the distinction between those who own their land and those who don't and have to rent it and give part of their production. They suffer, usually rural populations suffer lower earnings. Seasonality of employment, which impacts their earnings, is also common. Higher occurrences of sickness due to factors like malnutrition, but also external conditionalities such as frost, fire, hail, and loss of crop or livestock affect the sustainability of the livelihoods. What we have also in rural areas is less developed public services, which also result as a whole into a situation where most of the social protection gaps that we observe worldwide are found in these rural areas, and COVID-19 crisis actually only exacerbated the challenge these populations face even more, especially in those countries where social protection systems were less developed than in others. So how did the crisis affect these challenges? In a way, the crisis and continues to do so, just made these usual challenges that social protection systems seek to address more acute. and this has been indicated by all of our participants. The challenges are two: health protection on one side and securing income security on the other. At the beginning, many considered that, and you, Anna, you also alluded to that, that rural areas would be less severely, less hardly impacted and affected than urban areas. But today we know that this is not the case, and that this is largely untrue, and the crisis only magnified the impact and the gaps in social protection in rural areas. The impact for persons who were already in a situation of vulnerability, for example, such as older persons, persons with pre-existing health conditions. Ms. Nanavati also referred to the challenges the crisis presented on women and girls in particular, with the closure of schools, the risk of violence, harassment, the risk of termination of schooling for girls, which is higher than for young boys. On women, the disproportionate, the fact that they disproportionately are responsible for unpaid and informal care work, the victims of gender-based violence, but also groups like the informal workers, the self-employed, the homeless, the ethnic and indigenous groups, the migrants or displaced persons, care workers. For all these groups that I'm mentioning, the crisis often entailed the lack of and the breach in food security, and the fact that the lack of public services only made the situation worse, combined with the lockdowns and restrictions, as our participants indicated, which prevented many people living in rural areas from accessing both medical care, but also income generation opportunities. And this was stressed by Ms. Nanavati in a great manner with the situation of accessing markets for rural populations, and the direct possibility to sell directly their products in the cities. Indeed, for rural populations, teleworking was largely not an option, and rural areas did not also prominently benefit from the stimulus packages that were designed. Sometimes they did, sometimes they did less, but mostly the focus was primarily put on the formal sector, and we know that the rural areas are characterized by the prevalence of informality, and these shares of the stimulus packages were often came as Ms. Nanavati indicated, as an afterthought. She used that word. In the absence of measures to support rural population, also the risk is that the populations develop coping strategies that are negative in a way, because there is the risk that they could be consuming the seeds, they could be selling the livestock that they have, and thus compromise their future food security, greater poverty, and compromising the sustainability of their livelihoods. So in the face of all these well-known challenges, the general thinking is that we must capitalize, and this was also indicated by our panelists. We must capitalize on the momentum that we have in favor of social protection, to use it to think out of the box and advocate for the gradual extension of social protection to all, and to universal social protection, as our participants indicated also. And for that, we need to start thinking of how to adopt longer term, to take the measures that were initiated during the pandemic, and to think more of longer term approaches aimed at developing universal and comprehensive social protection systems, and very importantly, systems that are coordinated with other main and relevant public policies. We mentioned education, we mentioned agricultural policy, occupational safety and health, for sure, is in the context of the pandemic and in the consequences of the pandemic will be an important element to be taken into account, tax policies, and so on. these policies should not and cannot exist in isolation. Public policies need to be seen as a continuum, as an integrated whole, and they cannot exist in isolation from one another. And coordination between them is crucial for ensuring coherence. And this was also stressed by Ms. Nanavati in her intervention. Another point I wish to make is that social protection is not only for the vulnerable, and this was also stressed by the current pandemic crisis. Social protection is for all. It is a universal human right. So we should not be thinking of social protection schemes for rural population as schemes for the poor, as schemes for the poor are poor schemes, as we tend to say usually. And this doesn't mean, of course, that we do not need to have social assistance schemes in rural areas. Of course, we need such schemes, and they represented a large part of the answer, as Mr. Sharif also indicated in terms of how social assistance was opened up to cater for the needs of populations generally, but also those in rural areas, opening up in terms of benefits increase, but also larger parts of the population that benefited. So social assistance proved its usefulness during the crisis, and many countries adopted responses to adapt it and facilitate access to the protection by, for example, relinquishing eligibility conditions, waiving conditionalities, increasing the amounts of the benefits, and so on. Of course, we need social assistance, but we also need social insurance in order to guarantee higher levels of protection. And we need actually to adapt social insurance to the realities of the rural areas in terms of, and this was also stressed by many of the participants, in terms of the contribution collection, the financing, how the protection is to be financed, including by raising a tax on agricultural products, for example, opening up the social insurance to new categories such as the self-employed, which represent a very high share of the population living in rural areas. Some of the participants also stressed the importance of in-kind benefits during the pandemic, during the crisis. And these transfers in kind also proved their value and relevance during the crisis to secure the food security, combined with other measures, and also safeguards that need to be put in place in order to avoid corruption practices and so on, which are generally a little bit more prone to exist when sufficient safeguards have not been put in place. So the key here, I think, is to combine all these tools of social protection and mechanisms that exist to successfully extend to rural areas during the crisis, but also beyond. And the crisis showed how innovative thinking can actually be put to work in favor of this extension. So for that purpose, we need to build on existing structures, and we saw that countries who had a system and adapted the system, opened up the system, made better than those where the systems are much less developed. And we need them to adapt these structures more specifically to the specificities of the rural areas, but also harness the potential of new technologies. And many of our panelists also indicated how new technologies can be put to better enforce extension, to guarantee social distancing can happen better by waiving the requirements for in-person benefit collection, for example. Also scaling up electronic payments and the application for benefits in the rural areas. As a word of conclusion, quickly, I think what came out of our panelists indicated is that the time is ripe for action, and we need to launch comprehensive studies and think of a longer-term approach, not to waste the momentum in favor of social protection. And with that, I'm done and eager to hear the discussion that is to take place. Thank you.
Thank you so much, Krum, for these points, and especially the call for universal social protection and really distinguishing the types of social protection and the need to respond to everyone's needs and specific vulnerabilities and adapt the offer to the different profiles. We have 3 minutes for questions and answers. We will do our best to answer a few questions. And I think we will need to take note of those questions we have not been able to answer to live, and we will do it in writing. The answers from all the panelists will be posted on the page of the webinar. So we invite you to connect in a few days when all the recordings will be posted. I would like to direct a set of questions to Cecilia Mbaka. There were 3 questions directed to you from Stephen Kimoto, Gabriel Fernandez, and Stephen Ombere. The questions were to ask you first to describe a bit Kazim Mtaani. If you can just touch a bit upon it, the cost allocated and how many youths in rural areas have benefited from it. If you can provide a bit more details about the cluster mechanism initiated by the UN, if it was, if the cluster was initiated by the UN or not, and did this coordination mechanism assist in national broader coordination efforts? And third question for you is, what mechanism can you highlight that government has in place to assure that marginalized adolescent girls are protected? Thank you.
Okay, thank you so much, Anna, for your question. And thank you, Stephen, for your for raising the issue on Kazim Mtaani. I really wanted to speak to Kazim Mtaani, but unfortunately, I did not get enough information. As I said, our coordination on social protection interventions are still very weak, and we need to strengthen that. We have an opportunity to do that on who is doing what where through the National Social Protection Secretariat in the Ministry of Labor and Social Protection. In fact, we are planning to host a webinar to bring together the social protection practitioners to be able to share on what all of us are doing, and also to inform the ministry responsible for social protection. And I think, Stephen, we can side chat on that. On the question on cluster mechanism asked by Gabriel, I would want to say that the government of Kenya works very closely with the UN under the United Nations Development Assistance Framework, where we are looking at as delivering as one. However, coordination mechanism for COVID-19 is led by the Kenya government. We have several committees under the Ministry of Interior and the coordination. The Ministry of Labor is responsible for coordination on social protection initiatives that stakeholders are coming up with. And that is what I'm saying we really need to strengthen. I think COVID-19 has taught all of us on the need to strengthen systems so that when shocks like COVID-19 come, then we are able to respond better. So, Gabriel, the issues of coordination on COVID-19 are led by the government. On the issue of adolescent girls in marginalized areas, Anna, I propose that we answer that question later. Thank you.
Thank you so much, Cecilia. So we will have a bit more time. I mean, we can take 10 more minutes, and we hope attendees can stay a bit more to take a few more questions. We will finish in 9 minutes sharp. So whichever questions we have not been able to take live, we will take on in writing. So the following set of questions were actually directed to Munir Sherif. They thank you for the presentation and wanted to ask you for informal workers not linked to an employer, are they supported by any social assistance program which is non-contributive but based on a social contract? In other words, if a vulnerable worker is not able to contribute, will they still benefit from social protection? This is a question from Gabriel Fernandez. Another question for Munir Sherif. What are the delivery mechanisms for the different target groups? For example, non-salaried agricultural workers. Thank you. This is a question from Jacqueline Friese. Remember to turn on your audio. Non, toujours pas. Yes. Your audio is off. No, still not. Maybe while Mr. Sherif, while you turn on your audio, I will direct another question. I think Rima will be able to provide a very insightful answer to this one, given that she works directly with women. Oh, okay. Hello. Yes, so Rima, I wanted to ask you, has domestic violence increased in rural areas during the lockdown? What is the experience that you've seen? This is a question from Jacqueline Velasco.
Thank you so much. And yes, as I mentioned in my presentation, from the survey that we did, in 25% of the households, women and girls faced domestic violence. And also, we now see that more and more mental health is becoming a major issue. So I hope that when we talk about social protection, we will also include mental health as one of the major components of it. And domestic violence increased as, you know, men lost all their work and income. There was a lot of anxiety on how will the future scenario be, how will the repayment of the past debt be met with. The next agriculture season was on, and so how will they be able to prepare for that? The crop was ready for harvest and there was lockdown and could not go to the fields, and on top of it there was a lot of humiliation as men were just not allowed to go out of the house due to lockdown, and they also had addictions which they could not meet with. So where do you throw out all your frustration? And it was the women and the young girls in the families. Very unfortunate.
Indeed, Rima, thank you so much for highlighting this and focusing on the need to address mental health issues. This is really critical because the pandemic has had a tremendous impact on mental health of so many people. I want to just try one last time to see if Mr. Sherif has been able to turn on his audio. Otherwise, I will wrap up. Mr. Sherif. Mr. Sherif. Okay. I'm so sorry. Given the time that we're already over time, what I will do is that the questions remaining for Mr. Sherif. Yes. Have you been able to turn on the audio? No, not yet. Okay. Mr. Sherif, I'm very sorry. I think your audio is not working. So what I will do is that I will give you the opportunity to answer in writing to the questions that you've been asked, and you will also be able to share any materials that you want through the online platform. So I will just take I will take an extra minute to thank really all the panelists. This has been so rich and informative. I've really learned a lot from the different perspectives coming from government, civil society, academia. This was really, really enriching. I think that we have We have given a big overview of what has been achieved, but also all the challenges that we have ahead, because rural populations really need a dedicated approach to bridge the coverage gap to achieve universal social protection for all. And this really requires a dedicated approach and integrated approaches, as many have pointed out. So I also want to thank all the attendees for your participation and for all the very interesting questions. I wanted to ask the organizers for really superb organization. Thank you so very much. You can follow all the updates on the webinars. We'll post a summary, we'll post the presentations, there will be a recording. We will also post any materials that the panelists want to share, as well as the responses from the panelists to all the questions that have not been answered live. So thank you very much, and have a good day, afternoon, evening, morning, depending on where you are. It has been a real pleasure. Thank you.
Thank you so much, Anna. Thank you.
Yeah.
Thank you.
Thank you.
Bye.
Thank you, Professor
Thank you.
Dan. Thank you, Mark.